You are listening to the EPT Works Listen, Love, Give podcast. Hi, I'm Dr. Annette CARGIOLI, the Forgiveness Doctor. I'm here to help you create phenomenal health, happiness, and new life with energy, intuition, and forgiveness. EPT is short for Emotional Polarity Technique, an innovative, holistic emotional therapy that will change your life for good. You can subscribe to this podcast, get free EPT training at eptworks.com, and like us on Facebook. Welcome to episode 6. This episode is called Help for Borderline Personality Disorder with Emotional Polarity Technique. In this episode, you will learn how Emotional Polarity Technique provides unique, emotionally energetic-based therapy for people diagnosed with borderline personality disorder. You will learn why these people become cutters and why they are so prone to suicide and suicide threats. I'm going to talk about what is actually going on in the brain of a person with borderline personality disorder that creates so much of their suffering. I'll also discuss what is necessary to heal this disorder, how long that may take, and what is the best EPT therapeutic approach to help someone with borderline personality disorder. I'm going to start with some descriptions written by two medical doctors, Dr. Ann Applebaum and Dr. Frank Yeomans, describe borderline personality disorder in the following ways. The symptoms of borderline personality patients are similar to those for which most people seek psychiatric help. Depression, mood swings, the use and abuse of drugs and alcohol as a means of trying to feel better, obsessions, phobias, feelings of emptiness and loneliness, inability to tolerate being alone, and problems about eating. But in addition, borderlines show great difficulties in controlling ragefulness. They are unusually impulsive. They fall in and out of love suddenly. They tend to idealize other people and then abruptly despise them. A consequence of all this is that they typically look for help from a therapist and then suddenly quit in terrible disappointment and anger. Underneath all these symptoms, therapists began to see in borderline people an inability to tolerate the levels of anxiety, frustration, rejection, and loss that most people, most of us, are able to put up with. An inability to soothe and comfort themselves when they become upset, and an inability to control the impulses toward the expression through action of love and hate that most people are able to hold in check. And furthermore, what most defines the borderline personality is great difficulty holding on to a stable, consistent sense of oneself. Who am I? These people ask. My life is in chaos. Sometimes I feel like I can do anything. Other times, a lot of other times, I want to die because I feel so incompetent, helpless, and loathsome. I'm a lot of different people instead of being just one person. The one word that best characterizes borderline personality is instability. Their emotions are unstable, fluctuating wildly for no discernible reason. Their thinking is unstable, rational and clear at times, and then quite psychotic at other times. Their behavior is unstable, often with periods of excellent conduct, high efficiency, and trustworthiness, alternating with outbreaks of babyishness, suddenly quitting a job, withdrawing into isolation, failing. Their self-control is unstable, ranging from the extreme self-denial of anorexia to being at the mercy of impulses, and their relationships are unstable. They may sacrifice themselves for others only to reach their limits suddenly and fly into rageful reproaches, or they may curry favor with obedient submission only to rebel out of the blue in a tantrum. Associated with this instability is terrible anxiety, guilt, and self-loathing for which relief is sought at any cost. Medicine, drugs, alcohol, overeating, suicide. Self-mutilation is discovered by many borderline people to provide faster relief than anything else. Cutting or burning themselves or hitting themselves stops the anxiety temporarily. The effect upon others of all this trouble is profound. Family members never know what to expect from their volatile child, siblings, spouse, or parent, except they know they can expect trouble. Suicide threats and attempts, self-inflicted injuries, outbursts of rage and recrimination, impulsive marriages, divorces, pregnancies and abortions, repeated starting and stopping of jobs and school careers, and a pervasive sense on the part of the family of being unable to do anything to help. Sometimes severe and chronic chaos in the family life plays an important role, but you have to differentiate the objective behavior of the family from the client's subjective internal experience. And of course, the effect of the illness upon the life of the client is equally profound. Jobs are lost, successes are spoiled, relationships shattered, families alienated. The end result is all too often the failure of a promising life, or worse yet, a tragic suicide. The despair of borderline personality disorder clients is usually associated with self-destructive and impulsive behaviors, and therefore will almost always have coexisting mental health problems that lead to an exacerbation of their psychological and physical health. So these coexisting mental health problems that are commonly co-occurring with borderline personality include depression, substance abuse, eating disorders such as anorexia, bulimia, binge eating, anxiety disorders, bipolar disorder, antisocial personality disorder, narcissistic personality disorder, compulsive spending or gambling, compulsive and risky sexual behavior, suicide ideation, and deceptiveness or lying. Now, these things that are coexisting are a result of what the person with borderline personality disorder is going through. So you could get somebody who says, I'm depressed, and then you start to work with them and you realize all these other things are going on, that they're really having this issue of borderline personality, and depression is just kind of one of the things they do out of the borderline personality, or substance abuse. So you can have somebody who comes in and they're dealing with, I'm a crack addict, but in reality, they're self-medicating their borderline personality tendencies with crack. So you can see how you can kind of be fooled and think you're dealing with someone who's just deeply depressed or has anxiety or maybe is bipolar, when really those are offshoots of this other problem that is borderline personality, the extreme self-loathing, the emotional roller coaster. So it is common for them to have eating disorders. This is like really, really common. Anorexia, bulimia, and they are also prone to cutting. So these two things, if you see those two things, you most likely you're dealing with this particular disorder. I actually try to look for the slice marks on their arms when I'm considering this is their problem. I don't like real easily throw out there, are you borderline personality, or have you ever heard of this? If they have heard of it, they probably won't tell you. In fact, I don't think I've ever had anybody who has been diagnosed with borderline personality. I'm thinking of some of the older women who've come in to see me, who come in because they have depression or some anxiety or they smoke too much pot. I don't think I've ever had anyone come in and say, oh, and by the way, I've been diagnosed with borderline personality disorder. I have to bring it up before they'll go, yeah, I've heard of that. Why? Why are you asking me that? So I kind of don't bring it up until I'm pretty certain that's what's going on. I also don't want to label them. they go and look online and they freak out because they read how horrible it is when you read about it online. It sounds like something you don't want to have and that is never going to get better. That's really how it's presented. So I kind of look for the cut marks, because that's another thing. I have people who come in who cut who don't tell me they cut. I mean, it's kind of, why aren't you telling me this? You're telling me you're depressed. So I look for the cut marks. If I see them, I'll reach over and touch that scar and I'll ask, so did you do this? Is this a cut? Are you a cutter? And then I have found they are very truthful when I ask. Like, they won't say, no, and make up a story. They'll go, yes, I cut. And then they go into I feel bad about myself. They also will be very truthful about alcohol and drug abuse if I ask them. But they don't generally come in and say, I'm really using a lot of dope to manage my problems. They don't usually come in and tell me that. And they won't tell me how much they're drinking unless I get really specific and ask them. So, and it's very common that they will use cutting, alcohol, and drugs to manage the escalation of emotion that plagues them. So it's estimated that about 15% of all patients who seek psychiatric care have borderline personality disorder. These are the family members who seem to cause the grief and drama in the family. Because of the intensity of drama and emotion that occurs around these people, family members are always seeking help to heal them and the pain that they have caused in the family. You'll usually talk to a family member first. Well, it depends. If you've got teenagers, it'll usually be the family member, or it'll be a close family member who sees there is something terrible happening with this child and they don't know what to do, and they've been into rehab and they've been into the stress center and it's just really bad, and the child is threatening to commit suicide. And sometimes I hear it from the neighbor or a close family friend who's just also caught up in the drama of what's happening with this person in the family. It's not uncommon that the family comes to talk to you about it. This information is just fantastic for family members. I've been doing emotional polarity technique for over 20 years. And as you might imagine, I have had my share of clients who bring a family member to me who is demonstrating signs of borderline personality. Over the years, I have helped numerous borderline women and a few borderline men who found their way to me for healing. I've helped people from age 14 to 54. I definitely believe the earlier the therapeutic intervention, the better. And here's why. A 14-year-old has fewer opportunities to make really bad choices. As the person with this disorder gains more freedom in their life as an adult, they are prone to create more problems by their choices. They will create more self-hatred in their life because they will get into bad relationships. They will have restraining orders put against them. So they have these bad outcomes because of their symptoms. They tend to push people away, or you can't get away from them usually. That's why the restraining orders, which, by the way, there are men. I have had 2 men come to me because they heard me talk about borderline personality, and both of them had been married to or in serious relationships with more than 3 women with borderline personality, meaning there's a group of men out there who tends to attract women who have this problem, and they usually have to get restraining orders to get out of the relationship. It's really kind of a crazy thing. But I have to kind of chuckle when I see them, because I'm thinking, I don't know who's got the worst problem, the guy who ends up in this relationship or the girl who has borderline personality. I tend to side with the person with borderline personality, but I have done EPT to help these men to stop or figure out what is it in them that keeps attracting the woman with this disorder that they can't deal with. Usually they have a mother who has borderline personality. The 2 that I worked with did. So many try to escape the emotional intensity of what they go through by self-medicating with alcohol, pot, and other medications. Research through brain imaging with PET, which is the positron emission tomography, and functional MRI of people with borderline personality showed that the amygdala, The area of the brain that controls emotions and emotional responses appeared hyperactive and unable to return to normal on functional MRI during intense emotional events. The functional MRI studies showed that the amygdala would literally light up like a freight train and remain in that state for a longer period of time than a normal subject who was emotionally triggered. Once the person was emotionally triggered, the amygdala would become hyperactive and continue to escalate the emotional experience for a measurable period of time. Here's a few more facts about the amygdala, that part of the brain that lit up in the borderline personality person. 1, it is central to the expression of negative emotions like anger, sadness, grief, abandonment. The amygdala is central to the expression of those emotions. Number 2, the amygdala prompts the releases of adrenaline and other hormones into the bloodstream, thus disrupting the control of rational thought. Number 3, the amygdala coordinates the actions of the autonomic and endocrine or hormone systems and is involved in emotions. So when we have a class, we train people to do body scans. Well, the amygdala is part of my body scan with someone who has this going on. So what you know about level 1 EPT core training, body scanning, where we put a magnet over an organ, we test it, and then we do EPT to balance it. I do that with the amygdala on these people. So researchers found that these emotional episodes would last anywhere from 12 to 72 hours. I find that fascinating. It's like a headache. It's got a beginning, a middle, and an end. Like a migraine pattern, the emotional episode would have a noticeable beginning, an escalation to a peak intensity, and then a noticeable end. Once the emotional episode ends, it's as though the hyper-emotional, intense experience never occurred. This leads family members to wonder if they are just being manipulated by the person and nothing is really happening. But researchers found that there was something happening, and it was triggered by feelings of fear of abandonment or failure to meet expectations of others. In the person with borderline personality disorder, a minor rejection for you or me can trigger a hyper-emotional episodic brain event where the part of their brain called the amygdala becomes hyperactive in such a way to create a difficult experience of uncontrollable emotional intensity in the person. One client told me it was the kind of emotional intensity you might experience if you saw your child killed in front of you. Because it is triggered by a slight rejection or fear of abandonment, it is a very disproportionate emotional response for the person experiencing this hyper-emotional brain reaction they have no control over. This drives even more self-hatred as they know it is crazy and they still can't stop it or explain what is happening, and that they really have no control of this emotional event taking place in their body. The cutting they do to themselves is a coping mechanism. They figure out early on that hurting themselves will stop the hyper-emotional response briefly as the brain shifts attention to the cutting or hitting or burning as a way of preserving life. The shift of the brain's attention to the cutting or personal assault stops the emotional escalation temporarily to give the person an ever so tiny break from the emotional intensity that is taking place within them. When I have described what is actually happening to someone who has this problem and why the cutting relieves their pain, they are amazed at how accurately I describe it to them. I think they are a genius to figure out how to alleviate the emotional pain they are enduring by hitting themselves or cutting themselves when these emotional episodes occur. I believe the most empowering information I can share with these clients is the fact that there really is a physical, emotional event occurring that they have little or no control over once it starts. I tell them that even though an episode seems like the end of the world and that they are dying and it will never get better, the research shows that there is a distinct length of time these episodes last, 12 to 72 hours. Even if you do nothing, the episode will end on its own and you can get back to doing what you were doing before it started. I tell them people with migraine syndromes don't hate themselves just because they have migraines every now and then. They usually lie down in a dark room, take Imitrex, and wait until it ends. Unfortunately, there is no medication that provides relief from the emotionally intense episodes of borderline personality. Once an episode starts, it will rise to its peak of intensity before it finally ends on its own. Our first strategy is to start tracking the start and end to each emotional episodic event by marking it on a calendar. What time it started and when it was over. And how long was that? If your episode lasted 48 hours, it is likely that it is usually the case for you. You will probably always have 48-hour episodes. If it's a 12-hour episode, that's usually what you can expect. This gives you the power to notice when it starts and to calculate when it will most likely end, even before you are in the worst part of it, where you can't even think straight. By writing down the time the episode is likely to end, my client can see right in front of them how much longer it's going to be. This is incredibly empowering. Just knowing that something is really happening that cannot be controlled can help alleviate all the self-loathing and self-hatred that goes with this disorder. Once my client knows there is a very real pattern of emotional episodic events occurring that are brain-related, I explain how drugs, alcohol, and even some food sensitivities can make you more vulnerable to having worse symptoms. Basically, I ask my client to stop alcohol, drugs, wheat, dairy, and sugar for a month while we start EPT therapy. Motivation when they are at their worst is usually very high. And they're all in the beginning because they're only there because they're ready to die. And they've done this before. And I am usually very impressed with compliance in the beginning of my EPT therapy program. But, I don't hold out hope over all these years. They're just like anybody else. Once they go maybe 6, 7, 8 weeks and they're saying, I haven't had any episodes, or I had one episode and it was only 24 hours and I usually have a 3-day episode. I'm doing so much better. I'm going to go out and get drunk. They will try it. It's just going to have to be trial and error. I'm very forgiving with them. I know that a lot of people do that with their symptoms. I must be well. I don't have to eliminate these things anymore, take care of myself, and do due diligence for my body. But they are extra sensitive, and they have to come to the realization and a full acceptance that because of their extra sensitivity, they are not going to get away with doing these things. These things hurt your body. Alcohol and a lot of sugar, and wheat is a primary one. They're just better off eliminating the main things. If they add something back, it doesn't take very long for them they'll have an episode and they'll be all emotionally crazy and they want to tell me, oh, it had nothing to do with the fact that I got drunk. And then they'll tell me, why can't I go get drunk and everybody else can and they don't have this happen? So they know it's related. Some of that intensity can be very off-putting when you're a practitioner. You could feel like, I'm not helping, and oh, look at them, they're going crazy. But don't feel that way. Just be compassionate with them. They feel that deeply, and you're there to show them that you believe that it can change, and you're going to hold that space of belief until they start to realize and accept that their fragility is not going to let them use drugs and alcohol and bad habits, not sleeping, staying up all night, their fragility of their condition is not going to let them do that and still get well. So they kind of have to come to that. And once they do, I have to say, I think they're amazing. Their self-control and their ability to achieve something is off the chart, in my opinion. I always recommend 1 hour of EPT per week for the first month or two. My goal is to increase the time between emotional episodes and to also decrease the time an emotional episode occurs. At each EPT session, I start with known triggers of emotional rejection or abandonment and release those triggers by identifying the original rejection memory and what needs to be forgiven. I also use magnet energy over the amygdala, which is located above the base of the skull toward the center of the brain. I muscle test the amygdala with the north and south pole magnet and then counter with the emotional points and then start EPT from that point to discover the original memory or memories that cause or caused the escalation of the amygdala emotional response. I'm going to tell you that usually this goes back to toddler time, but not necessarily. It could be age 6, age 7, but it usually involves a story where the person experienced an extreme abandonment. So either a parent died or a parent abandoned them. They lost the father they loved and were stuck with their mom in a divorce. But there is usually surrounding it a story where that amygdala has not fully developed. Your amygdala actually doesn't fully develop, give you the brakes on emotional events in your life until it can be like at age 3 or it can be as late as age 6, age 7, where that amygdala has fully actually physically developed. The amygdala, it allows you to have the break. So an example of this would be a toddler who you say it's nap time and you turn the TV off and they cannot stop screaming about not having the TV. And they really can't. You have a 9-year-old and they understand that and they won't cry and cry and cry and cry and cry because their amygdala has developed and matured enough that they can actually handle that information and go on. So that's why I believe a lot of these, the amygdala is affected. The abandonment occurs at a time when the amygdala has not fully developed. And so when the triggers of abandonment or fear of abandonment happen later, that amygdala goes, oh, this kind of abandonment event goes with the time I was 3 years old. And now my amygdala is operating out of the physiology of a 3-year-old that has no brakes. I do EPT on the amygdala itself during episodes and after episodes. So a person might come in their appointment and they're in the middle of an episode. Honestly, you kind of hope that doesn't happen. They're a mess and they'll just blast you. They'll yell at you and they'll tell you it's not working and they'll just kind of act kind of crazy if they show up that way. But I have worked on people who showed up and were in the middle of an episode and they'll let me work on them, which is funny. They showed up, they really do want help. I have never stopped an episode, but I have significantly shortened the episodes a client has to experience. And even though they're in an episode, it really doesn't prevent you from going ahead and doing energy work if they'll say the statements but then they'll yell at you in between. They're having this intense experience that I can't even begin to understand because I haven't had that. So I have also lengthened the time between episodes occurring. I have seen a client go from 1 to 2 episodes per week to 1 episode in 6 months. I haven't found any nutritional supplement that will stop or minimize the pain of an episode. However, I have found that with a few of my clients, there is a standard process product that seems to help to shorten the length of time of an episode so that instead of a 72-hour episode, they have a 36-hour episode. The intensity is still off the chart difficult for them, but at least it's shorter overall. One of the things that will happen, they understand this, they will become very bonded to anybody they're working with to try to heal what they're going through. So it's not uncommon. I tell them, please don't call me at night. And if you start an episode and you're in the middle of the episode, do not call me screaming at me. Because all I'm going to ask you is, what time did it start? Oh, well, let's see. How long do yours usually last? Well, then you've got 12 more hours. I'll talk to you then. That's what I do if they call me. I just talk about, when did it start? Oh, you're going to be fine. Stay away from the knife drawer. And they usually kind of calm down, because all of a sudden you have put them in a position of being an observer of what is going on. And that does help, although the intensity still escalates to the end. One of the best forms of psychotherapy that's out there, and people ask this question, developed by Dr. Marcia Linehan for treating patients with borderline personality disorder, is dialectical behavioral therapy, DBT. Now, the problem with this is a lot of people who have this disorder will only go to therapy for so long. I think the reason they love EPT is because they don't have to work so hard and they get results. When they go like this dialectical behavioral therapy, DBT, it's a lot of work and it's a lot of show up. You have to show up and you're in a group, and it's emotional and mental work. And I think that, and the person still has all their episodes going on, it's like I'm dragging through this and I can't see what it's doing or if it's any better. And eventually they'll start to feel a little better and they dodge out as soon as they can. So they're known for not completing these types of therapy. But I have found, like, I've had one person who did EPT that got them really good results. And then they moved away and they were having episodes further apart. They knew they needed therapy, and they found this and totally said that therapy is a good therapy. But she didn't think she would have said that before the EPT. But she totally highly recommended it and said it helped a lot. So DBT is a cognitive behavioral treatment approach that teaches skills for identifying emotions, tolerating stress, interpersonal skills, and just being aware of your emotions. So did you hear that? This is what the successful psychotherapy for this does. It teaches skills for identifying emotions, tolerating stress, and being aware of your emotion. So that's what mainstream has that works. Can you see why EPT is phenomenal for this? I mean, really, EPT focuses on emotions and the eliminations of inappropriate emotional responses that no longer serve your life. It's not a miracle cure for borderline personality disorder. For me, a miracle cure are those EPT clients that walk in that make our egos big, fat, and happy. They've been depressed for 13 years, and 1 hour later, they are not depressed, and they go on through life coming back and sending tons of people to you going, she saw me one time, and I have never been the same. That's what I call a miracle cure. That doesn't happen with borderline personality disorder. So if you're looking for something to make your ego all fat and happy, borderline personality disorder is not going to do that in a very quick way. But with time and patience, I have seen amazing healing take place in people who have suffered with this disorder. In summary, Emotional Polarity Technique can alleviate the suffering of people with borderline personality disorder and help them heal. It won't happen overnight or in one session. But with time and consistency, these people's lives can be changed for good. My care plan includes 1. I ask the patient to keep track of their emotional episodes when they occur and how long they last. This becomes your way of knowing if you are actually helping them, and their way of seeing that you're actually helping them. Number 2, I ask the client to commit to weekly EPT sessions for at least the first 2 months. I do EPT on their current emotional state, on their amygdala, and on any crisis that may have occurred between visits. Number 3, I offer the supplements SP or checks, which I recommend they take 6 per day, and if an episode occurs, they take as many as 4 every hour of the episode. All it has the hope to do is to help shorten the length of time their episode is. EPT will do that over time as well. Another thing that I will use, but I'm not going to talk about in depth, is if they are on any kind of medications, I will totally add amino acid therapy to help them to wean themselves off the medications, because the medications also affect the brain and are going to prevent that amygdala from completely healing. Number 4, I suggest elimination of alcohol, drugs, pot, as well as wheat, dairy, and sugar. Number 5, I remind the client that these episodes are just something that happens in their physiology. You didn't cause this problem. It's not your fault. Don't use these episodes as a reason to hate yourself. Just write down when they start and end and make yourself as comfortable as you can. Lock yourself in your bedroom with your favorite clothes on and stay away from the knife drawer. Emotional Polarity Technique is an awesome therapy for people who have borderline personality disorder. It will help minimize and eliminate the chronic hyper-emotional episodes they are prone to experiencing. It will help to restore their sense of self-value and self-love. It will change their life for good and allow them to have a life they never thought was possible. I've seen it happen. If you have borderline personality disorder, just know that your life can heal and Emotional Polarity Technique can help. With time and patience, an EPT practitioner can help you transform your life and health for good. Create phenomenal health, happiness, and new life with energy, intuition, and forgiveness. This is not where you thought you were going. It's so much better. Thanks for listening. If you enjoyed this, please subscribe to this podcast, like us on Facebook, and go get your free EPT training at eptworks.com. I'm Dr. Annette Cargioli, the Forgiveness Doctor. Until next time, listen, love, give. EPT works.